Well, thank you for inviting me. My name is Dean Royles and I'm Director of Human Resources and Organisational Development at the Leeds Teaching Hospitals NHS Trust. The Trust is one of the largest in the country. We have about £1 billion turnover, have 16,000 staff. And I've been asked today to talk about really some of the power of intrinsic reward. I'll be looking at staff engagement and saying why that's a strong motivator for performance. When I look at what I'll be talking about, I'll be coming from a health perspective, but I can see lots of issues that relate to other parts of the public sector and to the education sector. So here we are at Leeds. We've got fantastic links with a fantastic university at Leeds University. We have a medical school and we have links around research and innovation, as well as the staff that we both employ in that field, but also in our other professions that are serving our public, as well as those that are going to do business school qualifications. So lots of links in terms of the people that we serve and work with, but also in health. When we look at things like reward and recognition, I'll be thinking of doctors, of consultants, highly engaged professional staff. Likewise, in the university sector, there's professors and lecturers and researchers that you would argue have a similar sort of mindset around this issue. So I can see that sort of emotional issue that we have to address when we're looking at reward and performance in those areas. I think as people listen to my talk today and they go back after a very enjoyable conference, there's been some great speakers. I hope that what they'll pick up from my talk will be the need really for a people strategy, and a people strategy that has a number of equally important parts of it. So something about that workforce plan, something about talent and leadership, something about education and training, but also something about staff engagement and that area of intrinsic reward, and trying to give that as much effort, as much emphasis as they do in the other aspects that they would do of their people plan. I mean, one of the things it seems to me is that there's been an endless debate about sort of HR at the top table, and to some extent that's a healthy debate because people care about it, so they want to have that debate and discussion. I think in health, as a HR community, we've won the debate about who should be at the top table, and over a number of years there's been a bit of a tussle about sort of which profession should be joining the doctors and the nurses and the finance people at the table. And there's the estates have got and facilities have got a call to be at that table. IT and informatics, enormous in the NHS, have a call to be at that table. Communications and the way that we engage with the public and patients has a call to be at the table. But I think that you'll largely find that HR won the debate about that we are delivering services through staff, and therefore we need that HR voice at the top table. So I think that the debate on who should be there has been won. We as a community now have the challenge to show that we can deliver on what we promised we could do.